Hello everyone, I am Beatrice. In this video, we'll look at lithium toxicity. So lithium is a medication that you can't afford not to know for your NCLEX or for your nursing school exam. It's a medication that is commonly tested because of that risk of safety. And before the end of this video, we'll look at some NCLEX type questions that will test your knowledge on this topic. If you are ready for today's lecture, let's begin. Now, one thing you need to know about lithium is that it's a mood stabilizer. So it's used to treat bipolar disorders, especially that manic episode. It helps to stabilize the mood. And it's excreted by the kidneys. It's excreted, in fact, entirely by the kidneys, not metabolized in the body. So because of that, before you start treatment, the patient should be assessed for kidney function. Lithium can affect cardiac and thyroid status. So this needs to also be assessed prior to treatment. And then you need to know that lithium interact with some medication like NSAIDs. NSAIDs are hard on the kidney. And remember, lithium is excreted by the kidney, entirely excreted by the kidney. It also interacts with diuretics. We know that diuretics is, in fact, is contraindicated in a patient taking lithium. The reason is because diuretics promote sodium excretion and water excretion. And we know that these two things, we need it in order to prevent lithium toxicity. I will explain it further as we go along. And then it also interacts with AC inhibitors. Now, lithium, the therapeutic range is very narrow, just 0.6 to 1.2 milli equivalent per liter. It's so narrow. So because of that, a little more than the therapeutic range can cause toxicity. And lithium, this medication have a lot of side effects. A major one is nephrotoxicity. So it affects the kidney because it's entirely excreted by the kidney. Other side effects you need to know, they should be in the mild form of it, include GI upset, nausea, vomiting, diarrhea, polyuria test. Then we have fine hand tremors. So take note, this one is fine hand tremors, not coarse hand tremor. So fine hand tremor is normal for as a side effect for someone taking lithium. But you need to watch closely so that you are sure that it's not coarse hand tremor where the hand tremor is so serious, so massive. And then fatigue, muscle weakness. We have electrolyte imbalances. The patient can experience weight gain and even hypothyroidism. That's why I said we need to assess the thyroid before patients start lithium. Now take note, this side effect that appear as if is okay. You need to watch closely because this should be mine. If it is serious, even nausea, vomiting, diarrhea, if it's serious, it can be a sign of lithium toxicity. So you need to watch closely to be sure that when the patient complains about any of the side effects, you are monitoring the serum level of lithium to be sure that the patient is still within the normal range and the patient is not having toxicity. You need to know that if the serum level of lithium is greater than 1.5 milli equivalent per liter, the patient is already into toxicity. That is toxicity, meaning lithium toxicity or lithium overdose. And that's a problem. We don't want the patient to get into this. That's why we monitor closely. Now, what are some of the signs of toxicity of lithium? Now, one of them is coarse hand tremor. So take note, the other one is fine hand tremor, but this one is coarse. So it will be so massive, so serious, the patient cannot balance the hand at all. You see the tremor everywhere. The hand will just be experiencing tremor, will be shaking uncontrollably. Then hypotension is another sign of toxicity of lithium. And then ataxia, that's imbalance in movement, inability to coordinate movement. We have confusion, then seizures, then tinnitus, that's ringing in the ears. And then we have nystagmus, that's uncontrollable eye movement where the eye continues to move without control. Then stupor, the patient is also at risk of blood vision. And then some cardiovascular collapse and then down to death, which we don't want the patient to get to. So these signs of toxicity, it can vary from moderate to severe, depending on the level or the amount of serum lithium. So if it gets to like above 2.5, that is severe lithium toxicity. If it's not handled quickly, the patient can die any minute. So it's so important. This medication is a medication of safety. It's commonly tested in NCLEX. You can't afford not to know this medication. Now let's look at the nursing intervention. So let's assume a patient is on lithium. The patient is not showing sign of toxicity yet. Still, you need to monitor the serum level of lithium. You need to monitor it closely to be sure it's within the range of 0.6 to 1.2 milli equivalent per liter. Then you need to assess the kidney function by checking the creatinine. You monitor it all the time, the BUN, blood urea nitrogen, and also monitor the sodium level. Now, the reason why I mentioned that you need to also monitor sodium is because If sodium is low in the body, sodium has inverse relationship with lithium. The kidney is going to mistake it for lithium and begin to reabsorb lithium. Remember, lithium is also a salt. So it begins to reabsorb lithium, leading to high lithium in the blood, which can cause toxicity. So you must monitor it. The sodium should be consistent. It should not be low. It should not be too high. In either of this is not good. Then, in case of toxicity, what are you to do as a nurse? You are going to stop the medication administration immediately. So you stop lithium immediately and you report or contact the healthcare provider. Then you are going to monitor vital signs, cardiac function. Patient should be on EKG, and then IV fluid administration. This is very important. When you administer IV fluid, the prescribed IV fluid, most times they prescribe maybe normal saline. Give it as prescribed. It's going to help to flush out that excess lithium. It will promote excretion of the lithium. So that's why hydration is very important. Then, if it's so severe, you have to prepare the patient for hemodialysis. Let's say it gets to above 2.5, or the patient is showing all those signs of severe toxicity. Just start preparing the patient for possible hemodialysis. Patient education. So, what are the things you need to teach patients concerning lithium? Teach them to take lithium as prescribed. They should not overdose or underdose, because part of the problem of toxicity of lithium is caused by most times dosing. When the patient takes too much of lithium dose, maybe they double dose, it can cause it. Or maybe a renal impairment, a patient is having some renal issues, it can cause lithium toxicity, or anything that causes dehydration at all, like diarrhea, vomiting, excessive sweating. Any of those things that causes a patient to lose fluid can cause lithium toxicity. Then teach the patient to stay hydrated, at least 2 to 3 liters of fluids, unless contraindicated, because lithium is excreted by the kidney. So if there is dehydration, patient is dehydrated, it's going to decrease the kidney clearance. And when that clearance is decreased, lithium is going to accumulate in the body, which is not good. It will lead to toxicity. Then patient should report any sign of illness, especially fever. Fever can lead to dehydration. We don't want that. And diarrhea, vomiting, any of those illness can cause dehydration. Even activity, it should be in moderation. Patients should not involve in activities that are too exhausting, that will make them sweat too much, because they will lose water, they will lose sodium in sweat. Then avoid sudden dietary salt changes. Very important. So patient taking lithium, we encourage them to take consistent sodium intake. Not too much of sodium, not low. Because I mentioned before that sodium and lithium act inversely. So the kidney, if it detects one is low, it begins to reabsorb the other. So if sodium is low, kidney is going to reabsorb lithium more, and that will cause toxicity. Then avoid over-the-counter medication NSAIDs. So this medication, over-the-counter medication NSAIDs, they are hard on the kidney. So if it affects the kidney will not be able to clear lithium, and that will cause accumulation of lithium, leading to toxicity. Diuretics, I've mentioned it before. Diuretics promote excretion of sodium and water, and those two things we need it in the case of a patient taking lithium. We don't want them to lose sodium, we don't want them to lose water, we want them to be hydrated. So because of that, diuretics is contraindicated in a patient taking lithium. So now let's review some NCLEX style questions that will test your knowledge on lithium toxicity. Question 1. A nurse is caring for a patient who has been taking lithium for bipolar disorder. The patient reports nausea, diarrhea, and coerced hand tremor. Which action should the nurse take first? A. Reassure the patient that these are normal side effects of lithium therapy. B. Hold the lithium dose and notify the healthcare provider. C. Instruct the patient to decrease fluid intake to reduce diarrhea. D. Document the findings and continue to monitor the patient. The best answer will be hold the lithium dose and notify the healthcare provider. Question 2. A nurse is assessing a client who started lithium therapy 1 week ago. Which finding should the nurse identify as an expected side effect rather than a sign of toxicity? A. Coerced hand tremor. B. Fine hand tremor. C. Ataxia. D. Confusion. The best answer will be fine hand tremor. Question 3. A client on lithium for bipolar disorder developed a headache and plans to take an over-the-counter medication. Which instruction should the nurse give? A. You can take ibuprofen freely. B. Avoid NSAID like ibuprofen unless approved by your provider. C. You should double your lithium dose when taking NSAID. D. Only take NSAID at night to avoid interaction. The best answer would be B. Avoid NSAID like ibuprofen unless approved by your provider. Question 4. A nurse is caring for a patient with lithium level of 2.2 milliequivalent per liter, which is the priority nursing action. A. Encourage the patient to ambulate in the hallway. B. Administer the next lithium dose. C. Hold lithium and prepare for possible hemodialysis. D. Provide high sodium snacks to reduce the level immediately. The best answer will be C. Hold lithium and prepare for possible hemodialysis. So that wraps up today's topic on lithium toxicity. If you find this video helpful, please like, share, and subscribe for more educational videos. Thanks for watching.